Don't we have bigger things to worry about than smoking?
My name is Linda Bald. I'm a professor of public health in the College of Medicine at the University of Edinburgh. I've been doing research on nicotine and tobacco for over 25 years, and I have a particular interest in the prevention of diseases that tobacco smoking causes, particularly cancer and diabetes.
So, Linda, thank you very much for agreeing to take part in this interview. My question for you couldn't be simpler. Smoking's done, right? We've got bigger things to worry about in the world right now.
False. It's not a done deal at all. We still have 1 in 8 adults who smoke in the UK. We have about 75,000 deaths every year in England from smoking. And we have 8 million people who die globally from tobacco use. And in fact, it's the only risk factor for all of the 4 big killers of people around the world, non-communicable diseases: cancer, diabetes, heart disease, circulatory disease, and respiratory disease. So it's absolutely not something that we've completely tackled. We've made huge progress, but there's a long way to go.
But obesity, that's the real big public health threat now, isn't it?
There are many things that challenge our health, and overweight and obesity is a growing risk. We've seen, certainly over the last 30 years in particular, but particularly the last couple of decades, a rise in overweight and obesity. And the challenging thing is that we're not making any progress on that. But it's still going to take some time until overweight and obesity overtakes smoking or tobacco use as the leading preventable cause of death.
Okay, but smoking rates are going down, but for example, vaping rates are going up.
That's true. And you could say that actually what's happened is that vaping has been replacing smoking, a new product. Now, vaping is not risk-free, but it's significantly less harmful than smoking. We do not have the evidence to suggest that vaping is going to cause anywhere near the burden of disease that tobacco does. Cigarettes are one of the only products that, when used as intended, will kill you. And smokers lose, on average, 10 years of life. Although we don't understand the risks of vaping fully, we know what's in vapes, particularly regulated vapes, and we have a strong regulatory structure in the UK. So it's inconceivable that there's going to be the scale of harm from vaping that we've seen from smoking.
So, Linda, I think you got a part of your role is as a Scottish civil servant. You're a formal advisor to the Scottish government. And I know I work for the English government, but have you got any tips for what we should be doing to drive smoking rates further down in England? What works when you get down to, 12%?
Yeah, I'm Chief Social Policy Advisor for the Scottish Government, and on population health, I chair their Place and Wellbeing Board, which is the Population Health Board. In Scotland, like England and other parts of the UK, we're fortunate because we have a lot of evidence to tell us what works in driving down smoking rates. We've been doing it for around 50 years, very slowly. We've not exhausted the toolkit of effective measures, particularly the price of the product, the availability of the product, what's in the product and how it's regulated, and addressing the promotion. And we still have some loopholes in promotion. But I think if we can deal with those 4 Ps and continue to do that, and then, of course, find additional measures that we want to apply, learn from other countries. So the smoke-free generation, gradually raising the age of sale, and some things that we just haven't done yet. Tobacco is still widely available in supermarkets, in convenience stores. So we think there's lots more that we could do. We just need to continue to keep pushing, apply those comprehensive measures, and we will get smoking rates even lower.
That's interesting. So you're hinting there at maybe reducing the number of outlets, which is something they're doing in New Zealand. And I can see how that would be a good thing for childhood obesity, because kids would have to walk further to buy the cigarettes. But what difference is it going to... I mean, if you're just reducing supply and you're not reducing demand, then aren't you just going to have that demand come up through cracks in the pavement?
Oh, you need to use supply and demand measures. And I mean, actually, youth vaping or youth smoking prevention is a success story. We have smoking rates now in teenagers, younger teenagers, of 1%, 2%. It's actually smoking cessation, supporting adults to quit. That is still the big challenge and is continuing to cause the death and disease. I think we will see a smoke-free generation. But what I'm saying is, in addition to the things that we are already doing or planning to do, there still are things that we can apply, and availability is one of them. But we have to stick with the current plan, comprehensive tobacco control, and then the measures that are proposed across the UK now, smoke-free generation, better availability of vaping for smoking cessation, addressing the concerns we have about youth vaping in a proportionate way, enforcement of underage sales for both tobacco and vaping, giving trading standards additional funding. These are new measures which will add to what we're already doing. But the most important part of the new measures, probably for me, in addition to the smoke-free generation, is more resources for effective treatment and support to help adults to quit. We have fantastic services in the UK. They've been eroded. So we need to support them and make vaping part of that offer with support, which is variable across the UK. So coming back to my point as a government advisor, as well as a public health professor, I see further steps that we could take.
Was I getting it right, reading between your lines right, when you said, here we've got the lowest ever levels of smoking rates in teenagers, just 1% of 11 to 15-year-olds in England are smokers at the moment. As that cohort ages, we're going to see a smoke-free generation, and our rising age of sale is going to come in behind that and just kind of finish the job.
That's certainly my hope. I think we can we've denormalized smoking so significantly in the UK. We can move in that direction, and we are doing. But let's not forget, the groups of both young people and adults who will continue to smoke are amongst the most disadvantaged in our country. So we need to think, as we apply measures, how can we really focus on inequalities? I said smoking was the leading preventable cause of death, or I should have done if I didn't, but it's also the leading preventable cause of inequalities in health. So that's another reason why, despite other things in public health like overweight and obesity, alcohol harms, all these things are so important to prevent disease, but smoking's still the number one thing that we need to do to support people to improve their health if they smoke.
Yeah, I think often when people say that they think that smoking and vaping, vaping is as harmful as smoking, they're only wrong in two ways. One is they don't understand how low the risk of vaping is, and they don't understand how high the risk of smoking is. Smoking's going to kill 2 out of 3 smokers if they don't quit first. We get 1 death in England every 8 minutes. We have 1 hospital admission down to smoking every minute. It's still a massive problem. So, okay, Linda, if I've got you right, then the things I have to remember from our conversation today are, sure, smoking is declining. We've been doing a good job, but we're a long way from done, and it's still Britain's biggest preventable killer. Second, we know what works. We just have to do it right. And maybe we haven't always been doing it right. Maybe we've got to get that enforcement right, relearn the lessons we had about smoking cessation. And number 3, let's not forget that the people who have been quitting first and fastest are the white middle class beardy blokes in their 60s who haven't smoked in 20 years. And the people who are getting left behind are the most disadvantaged. My neighbours in Hackney, living in the flats behind mine, where the smoking rates are still as high as they've ever been. People with poor mental health, homeless people, they're the people who deserve our help as much as everybody else. And we've just got to buckle down and finish the job. Is that the message?
That's the message. And on inequalities, let's not forget the groups that are still smoking, it's not just about their health. Smoking is causing poverty, it's contributing to poverty. As I always say to my colleagues in government working on poverty, a big priority in Scotland, let's not forget smoking as part of that.
Well, we've got evidence that shows that smokers in the northeast spend more in cash terms than smokers in the southeast. You know, they smoke more, they spend more, not just as a proportion of their income, but just like they spend about 20% more in cash terms.
That's correct. That's absolutely correct. So a long way to go still, huge progress, but let's not give up.
Okay, so Linda, the last question for you, true or false? Professor Linda Bald, smoking's done. True or false?
False.
Thanks, Linda. See you soon.